and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today we're going to go over Pica. Pica is a condition where children might either put in their mouth or actually eat non-food items. And we might go like, of course, why would they be eating these foods? Of course they should know it's not food, it can't taste good, like it doesn't make sense to us. But there are a few things to consider when we're thinking about Pica. The reason I want to talk about Pica is because a lot of autistic children have Pica, and there are things we can do to either eliminate or at least decrease those symptoms and definitely help keep your child safe. You know, as always, we want to ask, why does this happen? Is there something at the root that's causing this to happen? Is there something we can go after that's a cause here? Now, typically, the most common two things to look out for with Pica in terms of root causes are going to be a sensory piece. In other words, are they looking for that sensory stimulation, that sensory input from what they're eating or mouthing? Or is it a nutrient deficiency? So magnesium, zinc, iron, calcium, things like that. Or is it a little bit of both? When we're talking about what to do, how to treat Pica, we first need to think about safety for these children. If they're getting into things like laundry soap, dishwasher detergent, even bar soap, other chemicals, fertilizers and pesticides, you know, whatever they're going after, it's going to be different with each child. We want to make sure that we keep safety in mind. It's going to have to go beyond your normal child-proofing, right? Because whereas normal child-proofing, we can kind of anticipate what a 2, 3, or 4-year-old might be interested in getting into. With these children, our autistic children, and especially if they have these Pica tendencies, they're going to eat things that are not obvious to us to protect, even things like paper. So you may have to do things like lock up things that you would otherwise not consider locking up. You can buy various cabinet locks and even combination lock doorknobs. For instance, on our pantry, we actually have a keypad lock, and only the adults in our house know the code for that. And you can also get things like fridge locks and freezer locks if you're keeping anything in there that you don't want them to have uncontrolled access to. Now, in terms of the sensory piece, which could be a root cause of Pica, what can we do for our kids if they're seeking this sensory input from things like paper or soap? You know, is it the taste? Is it the texture? Is it how it crunches between their teeth? You know, trying to do a little bit of investigating and asking the child if they're verbal, what is it about these things that's appealing to them? If it's a sensory piece, maybe we can find a food item that has a similar quality or characteristic that could replace what they're searching for, what they're craving. Or we can give them things like an electric toothbrush, or we can give them, there are vibrating mouth tools that we can use to help children on the spectrum, children with Pica, children even with different oral sensory needs. We can help them get that input that they crave and that they need in order to feel regulated without making it something unsafe, like the items that they may be eating in the case of Pica. The other root cause for Pica is nutrient deficiency. Super commonly, zinc, iron, calcium, magnesium are deficient in cases of Pica, and then also, those are very often deficient in our children with autism. So now we have to ask ourselves, is there a connection between the Pica behavior and what our autistic kids trend towards anyways in terms of deficiencies? It may be worth doing some nutrient testing. It also wouldn't be harmful to give a very moderate dose of really any of those things, iron, magnesium, calcium, or zinc. You'd want to connect with a provider who is familiar with these nutrients and the nutrient deficiencies and the proper doses for children if you're going to go beyond sort of the recommended daily intake of those. And then also you want to make sure that, of course, at baseline, you have your child eating as well-rounded and as nutrient-rich a diet as you possibly can, understanding, of course, that a lot of our children are very picky eaters, and so that can be difficult. You know, even behaviorally, there are different things that we can do to try to address pica. Now, behavioral interventions are only going to go so far if there's a physiologic or a physical problem, like a nutrient deficiency. But this may be obvious, but I have to mention it anyways, just to bring it to the front of your mind. Tell the child when you see them eating a non-food item, that's not food, that's not safe for people to eat, we don't eat that, something along those lines, without shaming them, without imposing a sense of guilt, without overreacting such that they're getting attention from you for that. Just make it clear. It's not food, that's not safe, we don't eat that. I hope this has been a helpful little snippet of information for you on pica. If your child is suffering from pica or you suspect that they're suffering from pica, it's definitely worth addressing. Please make sure you subscribe to our weekly email newsletter on our website and follow us on social media. And remember, be gentle with yourself. You're doing a great job.